for, and I think that because of that, people are more apt to take better care of themselves. You know, they go for colonoscopies and they avoid a lot of probably major illnesses because they do those routine screenings.
Yes.
So I think that's a benefit. One thing that there's a problem with, and I can see this with our insurance, this could be something that could come up with a government ran system. For instance, we have to use lab 1 anytime we have any blood work or any lab work done. So because you have to send it into lab 1, sometimes it takes a week to get it back. Where if you just use the lab that the doctor uses, it could be back that afternoon.
Yes.
Or in the case of, I know there's been some people that I work with whose children have been tested for strep. Well, if you don't send it to lab 1, you have to pay the total cost for the strep test.
And lab 1 is cheaper than the doctor's lab.
It's paid 100% if you use lab 1.
Okay, so.
But if you don't, you have to pay 100%.
So you're saying, like, if you were to go on a public option, the government would find any way to make it cheaper, and then, like, if it's cheaper, it might not be as effective and as fast and the quality.
It's good because you can't, like, for instance, if you have strep throat, you can't wait a week to get the test back. You've got to have an antibiotic.
And that goes with my next question. Do you think the quality will decline if you are to put on a public plan? So you think that if the government has a hand in our healthcare system, that those sorts of things will happen?
I do. I think anytime that you have the government involved in something, there's going to be corruption in it, and there's going to be inefficiency.
Yes.
That's just the nature of big government. And I think that we should find some way to make it more competitive through the insurance companies and use that to regulate the cost.
Okay. If you didn't have your husband, how much percent of the salary would it be if you had to pay for our insurance without?
18%.
18%. And there's no way you could possibly.
There's no way I could afford that and have a car to drive and a house to live in. And, you know, that's only healthcare insurance. That's not auto insurance. That's not insurance for our home.
Yeah.
Or any other, you know, recreational vehicles that we might own. That's not life insurance, only healthcare.
Do you know any situations where people have been uninsured and needed medical attention? And, like, what was the outcome of that? Like, say someone desperately needed, like, an operation or something, but they did not have insurance. But in this country, you can't deny health care. So, have you known?
Which is a good thing.
It's a great thing. Right? Do you know any situations where someone has gone into a hospital and said, "I need this operation," but they had no means of paying for it?
I do. I have a book vendor who comes and he sells books to me in my library, and he's an older man, and he had to have open heart surgery, and it was an emergency thing. He kind of dropped dead on the floor, and they kind of brought him back and then had to do surgery on him, and his bill was over $100,000, and he did not have any health insurance because he couldn't afford it. So his wife called the hospital and talked to the people in the billing office and just explained the situation and told them that they would be getting no money out of them because, you know, they could not. There's no way they could pay $100,000. I don't think that they owned a home, so they couldn't have gotten their home.
Yes.
And so the hospital reduced their bill from $100,000 to $5,000.
So what do you think would happen if you were, like, you know, I happen to know that we could pay for that, but it would be that would put an extreme dent on our, you know, on our savings and everything. So do you think that if you were to be in that situation and, you know, someone who can't afford it, but it's still very expensive and it'd probably put us close to bankruptcy after that, do you think that your cost would be lowered at all?
No. And my insurance company would pay for it.
Yes.
And then that in turn would cause my insurance to be, and everyone in my group, everyone that I teach with, their insurance to be higher because of that.
Well, that concludes our interview. Thank you, Ms. Rhonda.
Take a look at the timeline of insurance in America. Between 1915 and 1920, proposals to create mandatory health insurance programs were debated and rejected in 16 states. In 1935, during the Depression, President Roosevelt signed the Social Security Act on August 14th.
In 1947, the Blue Cross Commission is estimated to create a nationwide doctors network. In 1965, only half of Americans aged 65 and over have health insurance. So President Johnson signs Medicare and Medicaid programs into law. Now jump to 2009, where the president is trying to pass a 2,000-page healthcare reform bill that has many finely printed details.
A bill that is responsible for an entire country must be very long and have many details.
I disagree. I think you can get the basic points we need with much fewer content.
Oh yes, that's brilliant. Have a bill that dictates an entire country be a few pages.
You know what it says in that 2,000-page disaster? It puts a 2% tax on anyone who doesn't take the public option.
Well, we must pay for this somehow.
I'd rather not pay for a disaster.
I don't call something that will insure 45 million people a disaster.
When it costs over $1 trillion and might insure many people who are here illegally, you're right, it's not a disaster, it's a monstrosity. And many people who don't have coverage can afford it, but just choose not to get any.
They choose not to get any because the capitalist health care is over-the-top expense.
So is this bill. In a time where we have a $9 trillion deficit.
I didn't hear you say that during the Bush presidency.
Then you weren't listening. Because I was. I was also saying how two-thirds of the branches of government were controlled by liberal Democrats. Isn't it funny how they get none of the blame?
Well, we will just have to see how this bill turns out.
I hope it gets thrown out.
I think we can both agree that we want this country to succeed and stay on top.
That is a stance we do have common ground on.
Well, that concludes our time here at Intense Issues. I'm Veronica Corningstone.
And I'm Ronald Burgundy, and we hope you have a pleasant evening. Stay classy.